think I'm recording.
Oh, you
Yes,
are?
I am.
Oh, I'm sorry. I didn't know.
Resume recording. Okay. Okay, let me take off my video so then I could, let me see if I could, I'm going to share my screen and let's see if, okay, my picture still shows up. Does it? Yes. Can everyone hear me?
Yeah, and you could, I think you could turn your video on and we would still see you and share your screen at the same time.
Okay, I have it just in my image right now, so I'll leave it like this and then I will speak and then I will convert back. How about that? Okay. Okay, so let me talk to you about our School of Nursing. My name is Dr. Maria Grandinetti. I am an associate faculty member at Wilkes University Passan School of Nursing. I have been at the Passan School of Nursing for the past 12 years. I am a registered nurse. I have been a nurse for 27 years. I really love nursing. I think you picked a perfect profession. And I'd just like to talk to you and share my experiences, why I love Wilkes University, and I hope that you will find similar and really enjoy it as well. Okay, let's talk about our school, and this is an aerial view of our campus. And as I was mentioning to Marina, it's like that we have even though we're in Wilkes-Barre, we are in a city, we really have a lot of greenery and a lot of lush trees and our greenway here, and it's a great campus. It's big enough, but it's small enough that you could have personal one-on-one knowing your professors by their name and them knowing you by your first name, and you're not going to be a number here. We have a number of buildings. As you can see here, we have, we're on 35 acres and we have 8 academic buildings and we have 20 residence halls and administration buildings. We have our library, which is right to the right here of this image. It's very convenient. The School of Nursing is to the building, the long building to the left, and admissions and financial aid is between the library and our next academic building, Bryseth. It's a wonderful campus. We have a lot of amenities, including a gym. We have conference centers. We have performance buildings. We have athletic fields. And right now, currently, we have approximately 1,500 undergraduate and graduate nursing students. Okay. Oftentimes, this is something that participants to our open house often ask in questions, so I always like to present it. We are named after John and Ann Passan. John J. Passan is a local businessman and he's a philanthropist. In 2015, our school was named after him, and you will see that this is our academic entrance and building here, and our NCLEX are in pass rate. So in 2017 to 2018, it was a 95.12, 18 to 19, 93.55, and our 19 to 20 is pending at this time. We do not have a collective number at this time. There has been delays, obvious reasons due to the pandemic and students testing. Okay, let's talk about the high school graduate requirements. So high school GPA 3.3 or 87% numerical, okay? Math and reading SAT scores 510 in each or higher, 1220 minimum, and ACT score of 21 or higher for students who do not complete the SATs. Math placement score is 18 or higher. There's 2 attempts that is permitted. Now, let me just admit this person, okay? And there is requirement for entry into science courses. So we need that math placement score. And I think Maureen could probably talk to you about that if you have any questions about that. And it's really pending upon, we want to have that score. If that score is not high enough, you will be asked to take Math 94 prior to your entry into our university, okay? You'll need to pass with a minimum of a 2.0 in order to enroll into biology and chemistry courses as a nursing major. So let's begin with our four-year baccalaureate nursing program. I'm really going to introduce you to our four-year program and our accelerated nursing program and some information about our graduate program, because I'm really not sure who is here and what program you're interested in, really. So our four-year baccalaureate nursing program I'm going to focus on in this presentation. It really provides a foundation for graduate study in nursing. We also have a one-year accelerated baccalaureate nursing program. This is a second degree program for those students who already have an existing bachelor's degree in another discipline other than nursing. It is a 12-month program. Our traditional nursing program is a four-year program. Unless you are transferring into our school after the first year or even the second year, okay? And they really both provide a foundation for graduate studying in nursing, okay? Let's talk about the curriculum and what can be expected. So let's talk about that freshman student, the first year and the first semester. So I'll give you the classes that are going to be, that you will be enrolled in, so you get an idea of what the curriculum will be. Let's talk about that freshman year, the first semester. You'll take a first year foundations. It's a class that all freshmen would take. If you're a transfer student, this course is often waived. You'll begin with anatomy and physiology 1. You'll have an English course, a chemistry course, and also, if needed, a CPR basic life support certification. Okay, we'll continue with that second semester freshman year. You'll have a microbiology course. You'll continue with human anatomy and physiology, but 2. You'll have sociology or anthropology. It is your choice, which one you would like. A psychology, it's a foundation course. And then you'll be asked to enroll in either a dance, an art, or a music course. Let's move on to the second year, which is the third semester. You'll be taking a statistics course. And the statistics course is really important for nursing, and because we have a number of dosage calculations, that medication dosage conversions and calculations. We want to make sure that you're really strong with that. Also, statistics is a foundation in a four-year degree program, especially if you would like to go into graduate studies. You'll be taking a nutrition course. This is where you're going to begin nursing. You'll be beginning nursing in the second semester, sophomore year. And you'll take nutrition, you'll take pathophysiology for the healthcare provider, and computer science and introduction to literature and culture. So you'll begin to have a nice foundation of pathophysiology. You've had your sciences, you've had your anatomy and physiologies, and your nutrition. Then we get to that second semester, sophomore year, which is we begin the clinical courses. Your first will be Principles of Nursing. Essentially, it's going to be a Fundamentals of Nursing course. It's really a wonderful course. You will participate in clinical practice in this course. So you will be going to agencies to care for patients in your sophomore year. Okay. You will be taking physical assessment, a pharmacology 1 credit course. Our pharmacology is broken up into 3 1-credit courses. You'll be taking a history course and an elective in psychology, whether developmental or adolescent or personality in psychology. You can see how the semesters are broken up, about 14 to 16 credits, really. And then we begin with the junior year. You will be taking a 6-credit medical surgical 1 course. Your next pharmacology course, you'll be taking a 3-credit nursing research course. And then you will be taking another nursing course, which is the psychiatric mental health nursing course, which is a 4-credit course. Both of the medical surgical 1, the 6-credit, and the 4-credit has an associated clinical practice component with it. That means you'll be going out to local agencies. Okay. Let's begin. Then we go into the junior year and to the second semester, which is the semester 6 in the program. You will continue with medical surgical nursing. Once again, your last pharmacology course, which is a 1-credit course. You will be taking nursing care of the childbearing family, obstetric nursing. Actually, that's something that I teach. You will be renewing, if needed, your CPR, your basic life support. And then you will be asked to take an environmental science course, a 3-credit. This will lead to the senior year. Senior year will compose of an advanced care concept course. And this is a course, a 5-credit course that really puts together your medical surgical knowledge for the complicated patients. So you'll be in intensive care units during this rotation, clinical rotation. You will have pediatric nursing course. And again, you will have a clinical component with that. You'll be taking population health, which is a non-clinical course, and then you will be taking either philosophy or a foreign language at that time. And your last semester, you will have a senior practicum, and senior practicum is mostly leadership. However, you are going to be in the clinical setting as well for this. And we're going to try to see if we could start transitioning you into that leadership role in the clinical setting, because once you graduate, you will be, after, you will have some training at the agency, but then you will be asked to lead and to manage an assignment of patients to care for. You will have a 2-credit gerontology nursing course. You will have nursing informatics, and I teach that course. And then you will have a preparation course. And this is really important because we have a 2-credit course that we provide a number of resources to prepare the nursing student to take the State Board of Nursing examination. In whatever state that you plan to be in after time of graduation, it's about preparing you to take that exam. We have some well-proven resources that we include in this 2-credit course. We include also some gaming activities with students. So we have some competition, which is really fun and great, but it's all about reinforcing the content that is learned in the curriculum. So there's total credit hours for the bachelor's degree in nursing. Their BSN degree is 120 credits. Okay. I'd just like to just briefly overview the undergraduate experience. Is that there are associate professors, assistant professors, and faculty of practice. We have all been in the School of Nursing for several years, some up to 25, 30 years. We teach not only in the classroom, but in the clinical setting. So we do this so that the faculty remain current in practice, and that's very important. So you may see some schools that are lecturers, that those professors do not practice in the clinical setting, but all of us teach the didactic course, the theory course, as well as the clinical course. Okay, we have a nursing lab, and it is called the Clinical Nursing Simulation Center. We have a number of patient rooms that are designed to simulate a patient's room at agencies, long-term and acute care settings. We have a number of mannequins, adult mannequins. We have child and we have newborn mannequins. We have a lot of resources that could assist you, prepare you. And this is where we really practice our skills. We get you ready as a beginning nursing student to go into the clinical agencies to care for patients. It's a safe zone. It's an area where you could make a mistake on a mannequin, but it really prepares you and allows us to test you on skills, so we know that you are comfortable and competent to provide nursing care. Okay, so our clinical experiences really vary. They vary in local healthcare settings. We use Geisinger Medical Center, the Wyoming Valley site, South Wilkes-Barre, and CMC Hospital in Scranton, Pennsylvania. We also use Wilkes-Barre General Hospital, First Hospital, Lehigh Valley Hospital in Hazleton and Danville, and Regional Hospital of Scranton, as well as Moses Taylor Hospital, as well as other locations. Okay. We have, here is a student to the left in our clinical nursing lab working on a mannequin, okay? And here is a clinical group. So our clinical groups range from 6 to 8 students maximum. We have no more than 8 students in a clinical group because we really need that attention, instructor and student. This is our scrubs, which we are asking our students to wear to the clinical setting. They are a blue top and bottom. The white shirt is optional. Some students feel a little chilly in clinical, so they're welcome to use to wear a white shirt underneath, and that's perfectly fine. Okay. Hang on for just a moment. Okay, and then we have nursing student activities. We have our nursing student organization, and which participates in community fundraising as well as attending conferences, research conferences, nursing conferences, and so on. We have our Sigma Theta Tau international chapter of Zeta Psi, which is our honor society for nurses. This is an invitation. However, we participate in similar activities as the student nurse organization. We have a Society of Student Nurses Club through our government clubs at the university. And we have the offering of a number of many university club memberships. Okay, you could see our dean all the way to the left, Dr. Deborah Begner, and this is these are students who were inducted into our Zeta Psi chapter of Sigma Theta Tau International. We have a great event. We have a brunch, and we celebrate the students. These honor cords that they're wearing, they are awarded with this, and then they wear their honor cords on top of their, with their graduation regalia when they do graduate. Okay. We have a number of different events, and we really try to prepare our students for the current times. We have simulated activities such as mass casualty disaster simulation and stopping the bleed. Right now, this time, we're really engaged with the pandemic and protective equipment, and really how to educate the community just to be prepared beyond patient care, but just caring for these emergency situations, and that's really relevant. Okay. We also have a number of community service opportunities where we help out the community, we participate in walks, fundraisers. We just love to get out into community and show ourselves as Wilkes University students and nursing students. As you can see here, this is a walk that I arranged. It was to benefit a local women's shelter. It's called Ruth's Place. They're located in Wilkes-Barre. We made posters and we wore our Wilkes gear. Some people even dressed up some of their dogs, you could see here. And we participate as a group. So we really love going out into the community and participating and supporting. Okay. We also participate in other events such as pediatric and agency flu clinics. So we administer the flu vaccine, and we also hold several times a year blood drives on campus and off campus. As you can see, our students participating here. Okay. We are a family of colonels, and we are colonel proud. You could see Mrs. Wander Rupert. This is one of our faculty of practice to the left, and another group of nursing students. We really become a family. Our courses are lower in number, and we really get to know everyone pretty much gets to know each other. We love to, we love to be a family together. So not only as a university, but within the School of Nursing. Okay, we have different events at our university. These, however, unfortunately, this fall semester are on hold. That includes the white coat ceremony, but we will be returning to that. It's a special ceremony in which you're awarded a white coat. You can see all the students with their blue scrubs on. It's really a celebration with family and friends in which introduces you into the profession of nursing. So we'll be held virtually this year, but we hope to have that once again next fall, that we would have that ceremony. A celebration is always wonderful. All faculty and staff in nursing attend anything that's related to you as a senior. We have senior salutes and senior farewells, and we really like to be engaged with our students as they complete their degree. And we like to celebrate them. There's nothing better than a faculty member to see our students graduate. A little overview of the graduate nursing program. We do have a graduate nursing program, and it is a Master's of Science in Nursing. We have nurse practitioner programs with focus in adult gerontology, psychiatric mental health, which is our largest enrolled program at this time, and our family nurse practitioner. We also have doctoral programs. We have a Doctor of Nursing Practice, which is a clinical doctorate degree, and we have a Doctor of Philosophy, a PhD in Nursing, which is a teaching and research degree. All of our graduate degrees are delivered online. Okay, and I have a little video here, and it really tells us how nurses change lives. If anything, during this pandemic, I think it's the community realizing that the nurses are critical at times of this pandemic, and we are frontline individuals. We spend primarily the most amount of time than any other healthcare provider in acute care setting. So I think people are recognizing the importance of nursing, the value of it as a profession, and how much it is needed. Let me show you this video. Let me see if I could, hopefully it links in here, and then you could see this.
During the Crimean War, more soldiers died from infection than in battle, until a nurse introduced sanitary practices still in use today. In the 1950s, jaundice was a leading cause of infant death.
Yeah, we're not seeing the video.
Found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her. During the Crimean War.
Okay. Okay, now I'm going to open this up to questions. I'm going to start my video again, and I'm going to stop sharing, and I would love for you to unmute if you would like, and we could, you're welcome to ask any questions of me or of Maureen. Anything that I presented. If you're uncomfortable in speaking, you could certainly use the chat.
Hi, this is Caitlin.
Hi, Caitlin.
Hi. Is the 3.3 GPA unweighted or weighted?
Go right ahead, Maureen, because you're from admissions.
Sure, yeah. So with the 3.3, it's technically unweighted, but we're going to take we understand like some schools are a 3.3 out of 4, some go out of 4.5 scale, some go out of a 5. So the 3.25 that we look at is on out of a 4.0. So that would be non-weighted. But again, we're going to look at every transcript specifically to see if you've had like AP or honors courses and things like that. So like I said, that would be out of a unweighted.
Okay.
Thank you.
Maureen. Thank you, Maureen.
You're welcome. And I do want to also mention, because I know on the video or on the presentation, it said that we look for around a 10-20 SAT. We are SAT like test optional for this upcoming school year for the nursing program. So I think that's important to note just for the at least for the 21 school year, because so many students didn't get the opportunity to take a test. So that's just something to note, that for the 21, if you're applying for fall of 21 or spring of 21, it is test optional. So we only need your transcripts.
Thank you. That's good to, that's good to call attention, because we have that in our slide and that's our standard, but
Correct.
we're in
non-standard times.
Yes, we're in unstandard times, and we're very flexible of a university, and we're understanding of that. And it is, and right now, even during this time, we are holding in School of Nursing, we are holding some face-to-face courses and some that are online. Our clinical courses are face-to-face. If you are going to agencies, we are not preventing our students from going into clinical agencies. We're not sure how long this is going to last for, and we're having our students and we're allowing them to go in, and we are welcomed in by these agencies. We need to prepare our nurses, and they are looking to hire nurses whether it be in the state of Pennsylvania or outside the state of Pennsylvania, and realizing that nursing schools, we need to provide that experience to the students. So a lot of hospitals been very welcoming, and we're very careful, and we're well educated, and our students our faculty and staff. So we go into these agencies and we are well prepared.
Just another question.
Sure.
I signed up for the SAT 4 times and they were all canceled.
Yes.
So how would I do the math placement test?
So the math placement test is actually you don't need that for admission into in your application, I should say. It's not needed for your application. So if and when you decide that Wilkes is where you want to go, it'll be in basically like May or June that we will, as your admissions counselor, and you were the one that's in California, right?
Yeah.
Okay, so your admissions counselor would be Erin, and she would reach out to you and give you the math placement. And it's pre-calculus, algebra, and we give you the information on it. So you don't need that in terms of your application. That will be once you decide that Wilkes is where you'd like to go.
Okay, thank you.
You're welcome.
And that's common practice at the universities, correct, Maureen?
For the math placement?
Yes.
I believe so.
For the sciences, yes.
For that's for at least for Wilkes, it's nursing, pharmacy, engineering, finance. So there's a lot of our, we just want to make sure that you have because not everybody takes calculus and pre-calculus, but that's where you need to sort of we need to make sure that you're at a certain level to be successful and have a base for the, I believe is it calculus that they take or pre-calculus?
Statistics.
Statistics, okay.
They take an introduction to statistics. It's just one of those math courses, and it's good because they're going to be taking some computer science, and computer science is important to take as well as nursing informatics, because not all schools have nursing informatics, but it's very important because at hospitals and long-term care agencies, we have converted our paper records in medicine to electronic health records. So it's very important to have those courses to best prepare our new graduates. I see that the video didn't show, huh?
It didn't. Okay. And that's okay. I just didn't know if you had the link close that maybe you could throw it in the chat. If not, it's okay. I just thought.
you know, this is so new, and, you know, clicking on that and just sharing the screen is just so, but it's actually, if you look on Johnson & Johnson nursing videos, you'll be able to, if you Google that and YouTube, I mean, there's some great videos, and it really, Johnson & Johnson has been, for the past 25 years, has been supporting the nurses around, not only with our nation, but worldwide. And they really promote our profession. You may have even seen these on when you're watching television as advertisements. So it's really wonderful of them.
Hi, my name is Sarah, and
Hi,
I
Sarah.
just have a quick question about taking the AP courses.
Mm-hmm.
So this year I'm actually taking AP Statistics. So if I am taking the AP test. So what would happen if I do score like a certain amount or higher?
I can answer. We do accept AP credits. I don't know. I can actually look it up. I have it right here. So for AP Stats, you would just need to send it through College Board to us, and then you need to score a 4 on it, and that would transfer in as Math 150. So is that what they take?
Mm-hmm. Correct.
Okay,
That's
yes.
it.
So, yep, that would transfer in, Sarah, no problem.
Yes, absolutely. You take that challenge test, and then you would be waived from that Math 150, which is the statistics course. Correct. Absolutely.
Okay, thank you so much.
You're welcome.
Hi, this is Danielle.
Hi, Danielle.
So I know you told us about like what a normal freshman semester would look like and so on. And I'm kind of going off of the AP thing. So if we have dual enrollment classes that we took in high school, what would happen during those classes that we would normally have during our freshman year, like statistics or calc?
Yeah, so, you know, our program, I wanted to communicate, and Maureen, you could jump in here as well, but some nursing programs require you to take a minimum number of credits as to stay in the program for nursing. So even if, for example, if you have your history or one of your arts or your psychology or communications, it's, you know, even though you transfer those in the dual enrollment, they'll still make you take more credits just to have a minimum credit load of 15 credits, for example. So that would not be the case. So Maureen, would you like to expand upon that?
Sure. Basically, Danielle, I think, and Marie, please tell me if there's anything that I'm saying that's not right, but my assumption is, for example, you do have to maintain a certain level of credit in terms of your financial aid. So I believe to be a full-time student, you have to be at least a 12. So if something transferred in that would drop you below 12 credits, you would have to take something to get you above that 12 to be considered full-time. But I believe what you could do, for example, is take a history or a philosophy or something that and then not take it, let's say I think there was one, it was like a foreign language that was maybe senior year or junior year. So instead of, if it fits into your schedule, you could take it in place of one of those other classes. So that way, when you get to that junior or senior year, you're taking 3 less credits. So that's kind of how it would work. Your advisor would work with you to, again, you just have to make sure you're at least 12 credits to be full-time for financial aid purposes. So what would happen again is if you were to drop below those 12, they would work with you to put something into your schedule that would fulfill a requirement and keep you full-time. Does that make sense, Danielle?
Yeah, it does. That helps a lot. Thank you.
Right. So
Sure.
it's about 14 to 16 credits. So each semester. So you could, so if you're, you know, there's students who have 4 classes, 6 classes, 2 credits, but you could space those out during the year, the 4 years, and you could lighten your load. Oftentimes students will lighten their load on the nursing course and clinical semester. So they don't have to, you don't have to you apply them all the freshman year. You could space those out. So I think that's a really great advantage of being dual enrolled in high school. Congratulations to you. And even those of you who have AP courses and you could test out of courses, it really, even 1 3-credit course less a semester is great, right? Makes it a little bit.
Nursing classes and those clinical times, absolutely. So if you can, that's great.
Right. So that's great. That's great.
Are there any study abroad programs for nursing?
Yeah. So how is that going, Maureen? Because it's tough during this pandemic time, and I'm not sure if we do have study abroad. We do have that. I think it's on hold right now, correct? If I'm wrong, Maureen, traveling?
Yeah. So there are, and again, there are no specific nursing study abroad opportunities. That gets very tricky with clinicals and things like that because we have to have, there's contracts involved and there's a lot of stuff on the back end that's involved. But so if a student did want to spend a semester abroad, it's going to have to be very early. Like I would say freshman year, spring semester, maybe fall semester, maybe. That's going to be tough, but there's a lot of study abroad opportunities that are not semester long. So for example, over the summer, and again, hopefully if and when things go back to normal, we do a summer in Spain. They have week-long over the holiday breaks, over spring breaks. So there are opportunities. It's just one of those things where you would need to make sure it doesn't impact your clinical, because that's the most, that's the most important. So if it was something over the summer that we run or over a spring break, you're absolutely able and able to go on those as long as it's not going to impact those clinical hours for nursing.
And also, I mean, I could say that I've been to Tanzania, Africa with nursing students who go into the hospitals. We've cared for patients. My specialty area is obstetric nursing. So we were in labor and delivery. We had newborns. So it was really a great experience. So there will be opportunities. I just can't foresee right now with the pandemic. And I think that's all universities and colleges, that we're just kind of waiting and watching. And when we have we will resume these opportunities once we are permitted to do so and to travel abroad.
Okay, thank you.
You're welcome.
I just have another question with the AP and the dual enrollment. So I have 2 classes that are AP this year, but I have the option of taking them as dual enrollment. What would you recommend with that?
Well, it's a good question. I would, that's hard.
And she doesn't have to test if she takes it as dual enrollment. She wouldn't have to take a later test if she had taken it as AP, correct?
Right.
So right. So I'm thinking that if you take it as dual enrollment and you take it at a university or college, right, Maureen? Correct me if I'm wrong. I mean, you will not be required to take it as if you take it as an AP course, and you would need to take that next layer, that next step, and to achieve a 4 or greater, correct?
Yeah, so that would be my only concern is you could take the class as an AP. If you don't pass the test and get the 3 and the 4, it won't transfer over. Whereas if you take it as a college course, I mean, you still have to maintain, I mean, you have to get a good grade on it, but I think that grade, depending on what it is, if it's like an English, they may take let's say a C+ or a B versus, if you don't get that 3 or 4 on the test, then we can't transfer it in. Whereas if it's transfer credit, we could. Does that make sense?
Yeah, does it count for the same amount of like credits and everything? Is it just like the way of acquiring them?
Correct.
Okay, that makes sense. Thank you.
You're welcome.
It's a good question, Daniel.
Yes. A lot of opportunities for those who are in high school. I mean, a lot of high schools offer these great opportunities. And I think it's wonderful because it really prepares you. Take college courses and it really prepares you how college is different than high school. And it is. Are any of you taking courses right now in dual enrollment?
I have a few classes this year that are so like the psychology, my chemistry, and then physics also goes over. And then I have like the AP Calc and the AP, what was it? Oh, AP English. So I wasn't sure if I wanted to do dual enrollment or AP.
Okay, all right. Okay, so you know that, you know, are you taking those courses remote at the college or university?
My school actually offers them. So
Okay, great. Terrific.
Danielle, the only thing I would suggest is keeping copies of the syllabus if you can, if you do end up taking them as dual enrollment, okay?
like the syllabus that the teacher gives us in the beginning of the year?
Yes.
Okay, thank
Yep.
you.
It's not necessarily always required, but sometimes our professors who look them over ask for them. So that's just, I always just tell people, because then it's easier for you to just know that they're around somewhere than try and find them and go back and email your teachers and things like that. So if you think about it, just kind of keep those somewhere on hand.
Okay, thank you.
Sure. We have a few more minutes. Are there any last admissions questions or nursing questions?
Okay. Okay. That's great. So Maureen, if you have, what is your telephone number if they have any admission questions?
Great question. So I'm actually going to put it in the chat. And you can email me or call me. I'm like, what's my phone number? I can't remember. Perfect. I always joke, I know a little about a lot of things. So if I can't answer your question, I will get you to the person who can.
Maureen, if you have any questions for me, you're certainly welcome to call me or to email me. And I'm on campus right now on Mondays and Tuesdays, mornings and afternoons of teaching. Okay. All right, well, listen, everyone, it's been really wonderful. It's been a pleasure. I hope that I have presented our program well and that you have a good understanding of what we could offer. I think it's a great profession. We have a great school of nursing, and Wilkes University is a really terrific school. So thank you very much for attending. I truly appreciate it.
Hopefully everybody too, if you are heading to the tour at noon, we'll have to get onto a different link. So you should have received that not that long ago, and that's going to start right at noon, and it's a beautiful day here, so it'll give you a really good idea of what it's like on campus. So
Great.
have a great rest of your day, everybody.
Okay. Thank you, everyone.
Take care.